My name is Viet. I'm a surgeon scientist focused on treating patients with oral head and neck cancers. Patients with oral cancer have a much more difficult treatment pathway because of the reduced funding, reduced public interest, because it's a rare cancer. Currently in my research, I am focused on understanding molecular signatures of oral cancer. And I hope that eventually we'll be able to deliver a clinically useful biomarker that could separate out the patients that are at most high risk of recurrence, and in those patients to be able to escalate their treatment.
Right now I'm coming back and I'm placing the dental implant.
As a trainee, I would attend ASCO meetings, and I knew that Conquer Cancer was a foundation that supported all different types of cancers, and they supported early career oncologists. The funding from Conquer Cancer allowed me to jumpstart my research projects, which ultimately led into multi-million-dollar funding. But that would not have been possible if I started from nothing. I think that with anything we do in life, at the end of the day, it's the human connection. I started in oral cancer research because of patient interactions. I continue to be driven because of my patients. Occasionally, I'll introduce my patients to each other because I think that their journey in cancer treatment is very lonely. And even if you have family members there to support you, it's very daunting to have to navigate this whole entire new world of cancer treatment without any support.
I have a doctor in Dr. Viet that is so knowledgeable about what's going on. She's pretty much a superstar.
She removed about 60% of my jaw and replaced it with my fibula. When the jaw healed, that could have been it. She could have stepped away. But she is looking at restoring me back to as close as she can before I had cancer.
Dr. Viet was a true advocate for both of us through this process. She was very kind and compassionate with us, sitting down, talking with us, and guiding us through Frank's entire journey.
I think what we're trying to do with research, with enrolling patients into clinical studies and clinical trials, is to be able to instill in them a sense of hope, not only for themselves, but also for cancer patients in the future. And even when they know that their enrollment into that study or trial might not directly benefit them, at the end of the day, it is giving future patients a hope for a better chance of cure. You can make a difference for every cancer.
Every patient.
Everywhere.
Make a gift at conquer.org.